Welcome to Med Study Hub. In this video, I'll guide you through Microbiology Important Questions, Paper 2 for University Exams. ChapterWise. Let's make exam prep easier. Stay tuned and don't forget to like, share, and subscribe. So, how did I select these questions? I've analyzed all previous year's university exam papers in detail and extracted the most important and probable questions for each chapter, and these questions are marked based on their importance and frequency of appearance. As you can see here, I have put 3 stars for very important, frequently repeated and recently appeared questions in RS for exams. Then I have marked 2 stars for the important, worth reading though it is not as frequently repeated. And lastly, 1 star for less probable, and those appeared in the past but not much repeated and not recently featured in RS4. So it is advised to focus on the 3-star questions first, followed by 2-star questions, and then review 1-star questions for completeness. This way, you can prioritize your preparation effectively. As in this video, we are focusing on Paper 2 topics. So these are the topics in Paper 2, and we will go to each section chapter-wise. So let's get started. First, we will start with Respiratory System, Chapter 60, Bacterial Pharyngitis. In this chapter, only Corynebacterium diphtheria is important topic, and these are the varieties of questions asked, and it is mainly asked as 5-marker or 3-marker. Okay, coming to the next chapter, which is Chapter 61. Streptococcus pneumonia is the topic which had came for 10 and 5 marks, and satellitism for 3 marks. So I think now you all got familiar about how I have extracted and represented each topic. Now we'll move on to next chapter. Next question. Next question. Next question. Next question. Coming to this chapter, this COVID-19 question most repeated one in recent RS4 exams for 10 marks. So don't miss it and cover everything in this. Next question. Next question. So this is the end of the respiratory system. Next we'll move on to the CNS. These questions, or every 10 marks, questions will mainly appear as clinical question. So be aware of clinical symptoms and causative agent. Now we'll move on to next chapter. Next question. Next question. Next question. Now we'll move on to next chapter. This UTI section is very important because it has only 2 chapters with very good weightage. Next question. Now we'll move on to next chapter. In Miscellaneous section, There are hardly few questions which are important. Oncogenic viruses are important. If possible, have a glance on their pathogenesis also. Next question. The zoonotic infections in other sections also appear in paper 2 only. Now we'll move on to next chapter. So the last part, some questions have came from Annexures part. Here it is interesting to note that the dengue fever question had appeared in both paper 1 and 2 for 5 marks. So be prepared for this important question for both the papers. So this is the end of the video. If you found it useful, please save it and share it with your friends. Thank you.